Hello viewers, this is Dr. Puja Dewan yet again with a legend in medicine. And right here with us is Dr. Ravi Kannan, a very unassuming, very simple humanitarian being. I can see that lovely smile coming through. He is a noted surgical oncologist and a director of Cachar Cancer Hospital and Research Center in Silchar in Assam. And he was formerly the head of surgical oncology at Adyar Cancer Institute in Chennai. That's a long journey from Chennai all the way to Assam. But along this journey, he has been conferred Padma Shri in 2020 for his selfless, charitable, philanthropic work in the field of medicine in an underprivileged, backward area in Assam, which is ridden with militancy, hesitancy. And he has been credited with giving opportunities of equitable opportunity for medical care. He is, of course, not just a recipient of Padma Shri, but a recipient of Mahavir Award in 2013 as well. Today, we will be discussing Dr. Ravi Kannan, his journey, his insights into his medical work, and would be engaging into the human side of Dr. Ravi. Welcome, Dr. Ravi Kannan, to the show.
Thank you.
Indeed, a pleasure to see that you are so unassuming and so down to earth, sir. May I move on and let's share the small little incident that is repeatedly quoted about you, that you were prominently placed and were actively working in Chennai in Adyar Cancer Institute, heading the unit of surgical oncology. And then one day, it's given to understand that a colleague and a friend of yours asked you to come for a consult all the way to Silchar. And that, I believe, was a turning point in your life. Let's hear a little more about it, sir.
So, when this hospital at Silchar was founded, it was founded in 1996. And the story of the hospital is pretty remarkable, Lay people of the valley got together and formed a cancer society. The nearest cancer hospital was in Guwahati, about 350 kilometers away. And even today, it can sometimes take as much as 20 hours to get there. And so those days, it was a much bigger problem. And people would have to go there for treatment. And most of them would not be able to complete treatment properly simply because the distance was so long in terms of time it takes. And so they formed a cancer society, and their former director visited a number of cancer centers in the initial years, around 2000. And he spent some time with us in Chennai. And after that, he was in regular touch, He would keep referring patients that needed help. At the Cancer Institute, we had a philosophy of treating everybody who comes in, irrespective of whether they're able to pay or not. And so the patients would keep coming, And I did visit this place once or twice in the initial years. And then what happened was I left the Cancer Institute in 2006. I was there for almost 15 years.
Oh, that's a long time.
And yeah, I learned many good things there. Whatever I am, is because of what I learned from my mentors at the Institute. Philosophy, surgical skills, scientific mind, whatever there is, is all that I learned there. I had very good mentors and amazing people, truly. And in 2006, sometime in November, I left the institute, and in December, Dr. Chaudhary calls up about some patient. And then I tell him I'm no longer there, that he should go ahead and send his patient there. Oh, what are you doing? One thing, several of us had left the institute around that time, and we formed a sort of loose group practice. And so when Dr. Chaudhary asked, he said, "Oh, why don't you come here? Bomb blast and you knew about floods." And so my wife Sita said, point blank, Ravi, we'll go to any place on earth but Assam. But the society people kept calling again and again and again. They would send letter after letter. So, we decided to come and take a look. So in April, my daughter was in class 4. She was in a school that did not believe in exams. Every day, Chinnu, what did you do? I played pa. So she had no concept of what an examination was at that time, And so we came in April. So I spent time in the hospital. Sita and my daughter went around the city. We went looking at schools, and every school, I'm amazed, the principals were so supportive. Doctor, come, your daughter will get admission. And if she doesn't know Hindi, she doesn't know Bangla, she doesn't know Akomiya. No, kids are very smart. They will learn very quickly. And just coincidentally, see, I am a through and through Kendriya Vidyalaya product. My dad was in the Air Force, So everywhere we would go to a new KV. And so I passed out from KV Tambaram, and the local KV principal, Hari, was my batch KV pass out from Kapurthala. In 2 minutes, it's just coincidental. In 2 minutes, we had that background. Oh, your daughter will get admission for this reason, this reason. Hey, Baba, she does not even know what an examination is, She had to take an entrance exam to get into school, But anyway, so before we went back, my wife, she used to be the regional officer at USFE in Chennai those days. And so before we went, I remember, sitting in the hotel on the windowsill, and she was sitting on the cot, and we had this discussion. And she said, Ravi, there is a lot of need here, and this is what we should be doing. So let's do it. And when we went back, she initiated the discussion in both our homes. Both sets of parents thought the fellows have gone mad. And my colleagues in the group practice, they were very concerned for me, They thought I was committing professional harakiri, They thought I should not be going away. And they've been very supportive after that also. And so, actually, that's how I broke the news to my colleagues. When I said I was going to take a look at Assam, my colleagues thought, that Sita is professionally employed and so she's unlikely to quit. So let this fellow go scratch his itch and come back. So when I came back, I told them, that Sita has resigned from work. And so next thing IFN asked me, so I should ask you, when are you leaving? That is how I broke the news to my colleagues, But we came here with very little idea of the challenges we would face or the challenges people in remote parts of the country face in accessing healthcare, We had no clue of administration. We just, we were firefighting. One problem solved, process put in place, moved on to the next problem. Before we solved the next problem, a third problem. We just went from problem to problem to problem to problem. And in many ways, even today, that's what we continue to be doing, But we have come a long way since the time we started in 2007.
True. In fact, your journey is a journey which is, when we look at this journey from the perspective of somebody who works in a tertiary hospital, a person who is working and has been trained in an urban city, a person who is used to certain basics, a person who cannot imagine that there can be challenges of terrain, let alone challenges of militancy. It is something which appears very fascinating, but on ground reality, it is challenging. It may be inspirational. In fact, you voiced and given the inputs about your wife, but she must be the true Sita behind the Ram.
See,
yes, please.
I think, for anybody, many people would like to do work like this, but perfectly valid compulsions, family, children, several issues or several things have to come together for something like this for an individual to, strike out and do something a little different from the routine, And I've been very, very, very fortunate. My parents supported me, my wife supported me, my daughter came with me. And so it just, credit does not go to me, And then I have amazing colleagues. in the hospital and outside the hospital, elsewhere in the country, who support me every time I call up for help.
So have you been able to draw talent from different quarters of the country and attract people to build a team with you, or the people with you are essentially from the local belt or at best from Assam?
So we started as a team of 23 people, I was the only doctor. We had 6 nurses, none of whom was formally trained. We had 2 lab technicians, we had 2 X-ray technicians, and we had 6 or 7 cleaning personnel. And we had 1 radiation physicist. And today we are more than 350 staff, we have 12 or 13 doctors, 170 nurses. So the hospital is actually mini India, we have people from Jammu, we have people from Chennai, we have people from Indore, we have people from many parts of the country.
In fact, so many people must be coming there to learn surgical skills because let me share with the audience that today Cachar Cancer Hospital and Medical Research Center is today catering to 20,000 patients per year. And with that kind of footfall, and it's drawing not just patients from the local belt or from Assam, but from entire Northeast. With that kind of footfall, I am sure people must be coming to learn surgical skills and cancer treatment from you.
See, when we treat poor patients, on one hand, we have a patient population that cannot pay for its treatment, and so they need to be supported. On the other hand, cancer is an expensive disease to treat. It is expensive to acquire cancer, and it is expensive to treat cancer also. And that costs money. Infrastructure costs money, chemotherapy costs money, targeted therapies cost money, investigation, everything is expensive. And on the third thing, it's like a triangle, The third angle is the staff. Just because we treat poor patients doesn't mean the staff remain poor. Nobody wants a lot, but then they must have enough, send their kids to a good school, get them good college education, build a house, own a car. These are not unreasonable expectations, And so, but then it is very difficult to have all the 3 corners meet, And so it's a perpetual challenge and then the location of the place, the what is available outside in terms of recreation, all that is limited, And so it is difficult to retain qualified youngsters for long. They come, sometimes they will stay for a couple of years and then they tend to move on, And so it is a challenge, but slowly everything will happen, I guess.
Your institute is a not-for-profit organization. And when you treat 20,000 patients at low cost or nearly no cost, and the patients travel from far away, how did you manage to generate monetary support and funds for the institution, for the therapies which are ongoing, the salaries and the basic facilities?
So it is difficult. It is not easy, but then it has happened. See, for one thing, our salaries are not great. They're not something to speak home about, and so that is one of the sore points for us to retain staff in the long run. The other thing is, over the years, the social milieu has changed. In the beginning, because we treat poor people, we took several policy decisions to ensure that we remain poor friendly. One of the most important things is the way we brand ourselves. So, if we, brand ourselves as a with the marble and fountains and paintings, it'll not convey a poor friendly approach. So from the milieu, which must be clean, and yet basic, to the way we talk to people, the way we talk outside. Everywhere we made a conscious effort to brand ourselves as poor friendly, not poor infrastructure, not poor treatment, but poor friendly environment. And then we kept all our costs low to start with. See, once you say cost of, an X-ray is say 1,000 rupees, and then, first instance itself, it frightens poor people. And so we deliberately kept all our service costs low. And then, we made sure, we don't, for consultation, for example, in the beginning, we used to charge 100 rupees for a month. And then over a period of time, we realized, patients have to pay month on month on month. So we made a one-time payment of 500 rupees and then a lifetime, no further charges. So that, several small and big measures to ensure that we remain poor friendly. And then initially, patients used to pay a small amounts of money. We used to get donations from, small and big amounts from different sources. Normally, donations should go into corpus building and infrastructure. But, given the nature of the organization, we are not able to do that. I understand it's a poor model, but that is how we were. And what happened is, over the years, we started getting support from different social organizations, from the Indian Cancer Society, from the NMBT, from Mahesh Memorial Trust, from SAI. So several organizations started giving us small amounts of money or larger amounts of money, depending on the organization, for patient care. And so we were able to treat a larger number of patients. We were able to support a larger number of patients without, looking back over the cost every time. And then what happened is the social insurance came in, the PMJY came in, and the local state governments, Atal Amrit Abhiyan came in. So now what is happening is, earlier we were getting small amounts of money from patients or from different funds, but that money used to be in our pocket to spend. So we were able to run our day-to-day expenditure easily. Now, because of these social insurance programs, we have more money, which is virtual, because we had to treat and then claim,
Then claim.
And so sometimes this claim process takes a long time.
It's long, it's long churn, and there is a wait period, and then it's an accumulation of an amount. And if you are you're virtually working on no profit and just sustaining, what kind of cost does it come for an average chemotherapy to a patient?
So let me give you an idea. Supposing you look at breast cancer, for example. So we use paclitaxel and adriamycin and cyclophosphamide. So we will give them 4 cycles of AC and 4 cycles of paclitaxel. So the whole chemotherapy will cost between 15 and 20,000 rupees, depending on whether
and RT, if any.
So radiation therapy will cost about 10 or 12,000 rupees.
And the surgical part?
Surgical part will be another 10-15,000 rupees.
So if we were to average 15, it would come within 50,000. So 50,000 in all.
Yeah, breast cancer treatment will be about 50,000 rupees. Which
investigations aside.
So initial investigations will cost about 8-9,000 rupees. And then very little investigations are needed. We only need a CBC every time we give chemotherapy.
Right.
And so the cost, but this is something most people will not be able to spend. Most people will not be able to afford. And so we end up having to subsidize more than 80% of our patients.
Oh, yeah.
Yeah. Even food, is a major challenge for many people. When we provide free food for patients in the hospital. And so it is not uncommon for a patient and a caregiver to share that same place. Sometimes it is heart-rending, to watch such things happen. Or sometimes the patient will not eat and the attendant will be eating. And if you ask, the patient will say, oh, he's not eaten for 3-4 days. And then, sometimes even though we try and spot such things, sometimes we miss. We're not able to spot them. And so, it is difficult.
So from what I have known of your model, that you are giving treatment either free of cost or at extremely low cost. And let me share with the audience that when you treat a number as large as that, and patients have attendants who come from far away, the attendants also have or loss of job opportunity or their day-to-day living. So it's a dual impact. And when the patient comes for treatment and it's a long-run treatment, they can't, as he said, that it can even take up to 20 hours to travel from a particular location to another. So that's the model that your institute, to my knowledge, is offering, is that the attendant and the patient both get a subsidized stay. The attendants are given an option to engage within the hospital for a service, whether it is as a cook, or whether it's watering the plants, or whether it's cleaning. And they are also looking at, of course, training the people who are attendants amongst that as a staff in future. Am I correct, sir?
Yeah, so when patients, most of our patients work for daily wages. And as you said, when they come for long drawn treatments, they have loss of earnings. And many times this is a major reason for default, So we have to take several sort of conventional and not so conventional measures in place, to ensure that patients actually accept and access the treatment that is provided. Earlier, I used to think, you provide free treatment, free food, accommodation, they'll all come for treatment. But that actually did not happen, and it took us a long time to realize what was happening. So, we started providing ad hoc employment. We started ensuring that everybody who leaves the hospital goes out with a follow-up date. And then if they don't turn up, we get on the phone or we make home visits, to make sure that they come back for treatment. We started making home calls. We started satellite clinics in different districts around us, so that, patients don't have to travel long distances for their follow-ups. And then, we reduce the cost of, daily consultations for food. So many, each small change adds to patient confidence. Many of these measures, I used to think, providing ad hoc employment is the, trump card that we have, So actually, a couple of years ago, we audited, and we found that we'd given employment only for about 40 odd patients. But the compliance to treatment, in the initial years, not even 30% of patients would complete treatment. Today, nearly 70-75% of our patients complete prescribed treatment. And all these support measures as a package act like confidence building measures. Most of our patients, I think, are afraid of our hospitals. They are hesitant to go to hospitals. See, many patients, if you look at a breast cancer, they will come with a 10 centimeter size lump. If you look at an oral cancer, there will be a ulcer which is perforated through the skin with
That's so sad, so sad.
Yeah.
So
and
sad.
these are organs which are so easily accessible to the patient himself or herself. A small ulcer in the mouth is so painful, the tongue will keep prodding it to see what is happening. A small breast lump, when the woman is bathing, she will feel it. If she has to wait for the tumor to become 10-12 centimeters in size, it's tragic, And I think the primary reason is they're afraid of going to hospitals, because they think if they go to hospitals, they will be out of pocket and the family will be on the streets. So what I realized, every small bit of support or kindness that we show, adds to that reputation, that these people may be okay to trust. And so that is why I think the compliance improves, and patients come and complete treatment, or they bring other patients long after their own patient is no more. The whole thing adds to sort of building confidence
the
report.
belts that you are working in, that belt has a notion that if somebody develops a cancer, it's the doomsday, and that this is the end of the entire journey. Besides, of course, being out of pocket, and also, incidentally, the region in which this hospital has been built, because of extensive tobacco, betel nut, and alcohol use, I'm given to understand that the cancer rates are quite high. I read, and I really appreciated the statement that you had made, that dignity of death with cancer should be given, and at least a cure should be offered for cancers which are curable. And I really appreciated that. In fact, there is a professor who wrote Professor Joydeep, and he's a cancer survivor, and he states that for Dr. Ravi Kannan, that I have never seen God. But if there is God, then it is Dr. Ravi Kannan, whom you can go and meet in Cachar Cancer Hospital. That speaks volumes for you. Absolutely. Dr. Ravi, moving on, can you tell me which is the most difficult case that you have handled in this hospital? Which moved you and it gave you gratification, or you could make an impact or a change? That one incident, that one case, that one person.
So this happened several years ago, We had done a Whipple's procedure on a patient, an abdominal operation.
For pancreatic cancer?
Yeah, for a periampullary cancer. And after the surgery, the patient needed some antibiotic or something. I forget what he needed. And the cost was 5,000 rupees or something like that, And so I called the man's wife and told her that this is what he needs. And she said, "Aap de do, sir. I will pay later." Okay, humne de diya, and the patient was going to be discharged. And the pathology report comes, node positive disease. So I call her and tell her that he is likely to need chemotherapy. And when I tell her she needs chemotherapy, she falls at my feet sobbing. "Discharge kar do." Gets over the nurse, discharge. Gets over everybody. Whomsoever she meets on the hospital, discharge. I said, "What is this?" "Okay, discharge kar do." And Debu, our pharmacist those days, came and told me, "Sir, we have drugs. We can give them to her without charge." I said, "Okay, shall I tell her?" "Tell her." So when Debu tells her that he will give her free chemotherapy, she starts sobbing, "Arey, what happened?" She didn't have 5,000 rupees. So she had a 7-year-old son. She went and pledged him to a village landlord for 5,000 rupees for 2 years. That day, the boy has called from somewhere. He doesn't know he's been sold off. "They make me fetch water from far off. My chest hurts. When are you going to come and take me back?" All our hair stood out, I said, "What is this? This has happened because of us. We didn't make it happen, but it happened because of us."
Yeah.
So we gave her the 5. She wouldn't touch that 5,000 rupees. You won't believe, we were all righteously angry, we'll call the SP, we'll call the MP, we'll call this, we'll call that. She wouldn't budge. Much later, I realized, see, she has to go back to that village. She has to stay. She cannot quarrel with the landlord and live there. So what will happen? She doesn't have the courage to do that. The husband was in the hospital for a few more days. Somehow we managed to convince him. The landlord must have been a kind man. The boy came to see me. The worst thing is, 9 months later, the man developed recurrent cancer and he died. So,
pancreatic cancer, the survival rate can be really challenging. I mean, it's one amongst the cancers which should not be the devil amongst the devils. That's one which has a very poor survival rate on the whole. Yeah, I mean, this is life. This is life, and the aspects of life which you and I may not have seen in the other side of the world. In fact, on a different note, I mean, what was the most drastic change that you or your family experienced when moving from Chennai to Silchar?
Wherever we go, we have received with so much of affection and kindness, Everywhere. I have never been to a place where people have been unkind to us, In Chennai, nobody knows anybody.
They say success begets success. Poverty begets poverty. But sir, kindness also begets kindness, and nobility begets nobility. Humanity begets humanity. It's a vicious cycle, a vicarious cycle, whatever you may call it. But the fact is that what life is a full circle. What goes on comes back. What you give comes back. It's a journey. It's a journey which you see within your lifespan if you're fortunate. And I think this is not gratitude, but this is the true wealth of life which you are experiencing as an enriched human being. Also now, when you're so far away and in a remote place and you are at the helm of things, you're managing things, you are the admin, you are the surgeon, you are the social network, you are the social worker, you are the financer, you are everything. So somewhere in that entire canvas, what really happens to your core surgical skills? How do you keep yourself up notch there, getting the right skill or the right machinery or the right protocol, etc. in place? I mean, there are so many challenges. You're one person.
So, one of the reasons we have a very bad administration is because all of us take a lot of clinical burden, clinical work, Ultimately, that is our primary job and that's the primary focus. So, everybody complains, that this is not happening, that administration is poor because all of us have to shoulder clinical responsibilities, which is non-negotiable. Now, the other good thing is, when you have colleagues, more and more youngsters joining you, they will keep you on top. And it's very important for anybody working in a situation like this to keep reminding ourselves that delivering substandard care is not acceptable. What is delivered in London or Mumbai or Chennai must happen here also. And so just because you treat poor people, ignorant people, doesn't mean you compromise on the quality of care. That will be medical fraud. And so you have to keep now a lot of learning, because thanks to COVID, a lot of learning happens more easily. You don't have to travel for a meeting or travel for a conference or travel for a lecture.
It's a virtual world. It's a virtual world with a distributed workplace and workforce where people are accepting. I mean, I'm here today interviewing you and proud to interview you, but had this platform not been there.
Correct.
So a lot of virtual conferences are keeping you updated. Since you mentioned, of course, you're in a remote area and there are so many challenges. How does the blasts and the militancy really affect your life or the hospital?
It's all gone now. Okay. It's all very peaceful.
And what do you do really for recreation? Just when we started this interview, I heard the bark of your pet dog, and that's Hero, isn't it? And you've named it Hero after a Japanese word called courage.
Yes.
And you have to be courageous to be where you are, in the place that you are, the surgery that you do, and you are a pet lover as much as I am myself a dog lover. And so let's know something about this facet.
I love reading. I love music. My parents were passionate about Carnatic music, and they're equally into Hindustani music also. And we love traveling. We love,
So traveling. Do you sing or you play or you listen?
I used to learn to play the violin from MSG, but then over the years, now everything is gone.
MS Subramaniam?
MS Gopalakrishnan.
Okay.
And I used to learn to sing from a guru here, locally here. But now last year and a half, that is also at a halt. And travel. We love traveling to places where nobody else has gone.
They say that arts are more predominant in people who have surgical skills, because it's all about that part of your brain which is connected with the arts. That's what they say about surgeons.
I don't know.
That's what they say about surgeons. The gifted, nimble fingers, the skilled hands. And what about your daughter? When you came in, it was grade 4, grade 5 transition. And how did she adapt to it? And what is she doing now?
She adapted pretty well, you know. She's just finishing internship. Another 2 weeks, she would have finished.
And so she also intends to go towards the medical field. Is that what it is?
She's qualified. No, 2 more weeks. Internship will be over. After that,
right.
I don't know what she will do. Kids these days are different, you know.
So has she taken to your philanthropic self, and does she intend to be with you?
I have no idea. I don't sort of brainwash her, you know. She will make her own decisions in her life. I made mine. She will make hers.
And what about Mrs. Kannan? Is she with you in the institution, working actively?
She volunteers. She's not employed, but she volunteers in the hospital and helps with a whole range of things, you know. I wouldn't be here but for her.
And do you miss your cuisine and food back home?
No,
completely different here?
No. We have a full running South Indian household here. And we live just the way we used to live in Chennai.
And
earlier we used to get all the rice and dal from Chennai, but now everything is available locally here.
Oh, that's nice. That's nice. And how connected are you with your alumnus back in Chennai? And you from Maulana Azad Medical College, right?
Azad. Yeah.
I'm also a MAMSiite. I'm also an alumnus from MAMSI.
Oh.
It's a small world.
Yeah, it is.
You enjoy music. I'm passionate about music. I'm a dog lover. You're a dog lover. You're about MAMSI, and that's how it is. And there is, I mean, it's a small world after all. And so what reminds you about 24H, the canteen?
24 hours, yes.
24H, the canteen. There used to thrive, and the boys' hostel right opposite the mess.
Yes.
And the surgery department and the residency and the post-graduation from there? Yes.
I had amazing mentors there, you know, Dr. Sarda, Dr. Chachar, Dr. Anand. Dr. B.S. Rana used to be our professor those days. And I had a very good time there.
Does being where you are give you a lot of, inroads into research? Because there's a wealth of patients.
Yes.
And are you into research?
Yeah, so we work with the ICMR, we work with the Department of Biotechnology. We are into clinical work, clinical research and epidemiological research, also into basic sciences research. One of my colleagues, you know, Rajiv, he did his PhD with us here. He set up the lab, and we have a very good basic sciences research lab as well. Research is very important, you know, in order for an organization to grow. Not all research has to be, you know, earth-shattering, Nobel Prize winning, you know, simple things, you know, to do things better, audit what is happening, see what is going wrong. Research for quality improvement, you know, issues. So, you know, research is a big term, but anything that you inquire into to change things around constitutes research. It could be as simple as ensuring patients don't fall off their beds and how to prevent falls, or how to reduce patient pain, as it is to look at genes and molecular markers. And
so as we close the discussion today, it's been immense pleasure, but I will not close without asking you a question. The question is a very simple, oft-repeated question, but it has a second line to it as well. The question is, how do you see yourself as a path breaker in future, in the years to come? You have already broken many norms. You have brought in a lot of change, but what do you see as the path ahead for you? And you are involved, your wife is involved. Do you see yourself walking down the path very similar to Baba Amte?
Baba Amte was a great soul. He was a very big soul. I'm nowhere near that. Baba Amte, sons Prakash Amte, and they're all amazing people.
His son Prakash.
Yeah, they're
And
all
his
amazing.
son, daughter-in-laws, now the generation next.
Yeah.
It's a world.
Yeah, they are different, I'm nowhere near that. I did what I like doing. I won't call it sacrifice. I won't call it charity. I don't believe it's either of those. I'm doing what I like doing. And if I can make life of people around me that much little better, I will be happy. And if I can create a system that will last beyond me. See, if something is going to happen because I'm here and then I walk away, if the whole thing collapses, then I might as well have not come here. So if I can create a system that will continue, it will evolve. It will not be the same as what I set it out to be, People have to change. That is okay. But the basic core principles of service, if that is maintained, I'll be happy.
Something which is sustainable beyond you.
Yes.
After you.
Yes.
With your footprints of nobility, humanity, and philanthropy. Thank you, Dr. Ravi Kannan, for being on the show today. It was incredible. Thanks a lot. I hope the audience enjoyed. Bye-bye.
Thank you. Good night.